Hello everyone, we are HKSEC. We would like to show you a video clip before we start our presentation.
攞咗藥唔記得食藥，你有冇試過呢？
匆忙啊，咁樣有時翻工啊，或者唔記得啊，趕住車啊，咁樣幾廿樣。做開第二樣嘢時都唔會唔記得啦嚇，就咁樣。
最長試過幾耐冇食藥？
都係1日到嘅啫，血壓高咗咯，糖尿又高咗咯，有時啊手震啊啲咁咯。
年紀大就話冇記性啫，都有人擔心副作用，自己停藥。藥劑師學會訪問咗400幾個公立醫院病人，有27%人冇跟足指示食藥，平均每人每個月嘥咗大約41蚊嘅藥，佔咗全部處方藥物嘅6%。嘥得最多嘅就係血壓藥、糖尿同埋膽固醇藥。
醫生開咗藥單，咁跟住就去藥房攞咗藥，咁就算啦咁。咁但係翻到屋企咧，就好多時佢哋就會自己做醫生啦，自己去調教啦。就話哎呀呢隻食完之後好多尿喎咁，所以佢哋就寧願揀唔食啦。唔
記得食，唔依指示食藥，咪以為隔幾個鐘補翻就得啊！
咁如果你血壓藥又唔食，糖尿藥又唔食，即係結果係點啊？身體咪差晒咯。即係你開頭可能唔係好明顯嘅，但係10年後咧，你啲病徵咧就可以開始浮出嚟啦，開始有呢個尿蛋白啊等等嘅腎病嘅問題嘅徵兆出現咯咁。
From the video, you may notice that there are many people are suffering from different drug problems, but currently, unfortunately, we have no such sufficient resource to help them. So, according to the Hospital Authority annual report, the manpower shortage is a major challenge that in the public healthcare system in Hong Kong. And you'll feel very disappointed to hear this. A doctor spends on average only 5 minutes on its outpatient. And our social workers who visit the elderly with chronic disease regularly, they do not have necessary knowledge of drug to help them. And also, an investigation of the pharmacy resource in Hong Kong indicates that one pharmacy in Hong Kong has to serve 5,000 local residents, and this number in UK is only 2,000. And also, a study from the School of Pharmacists of the Chinese University of Hong Kong shows 50% of the drug-related problems discovered in our elderly is because of lacking knowledge about medication and disease state. The low drug awareness will increase the trend of medication non-compliance. Every year, there are 2.3 million cases of specialist outpatients with drug non-compliance problem, and 1.1 billion Hong Kong dollars of healthcare expenditure has been wasted. And the low drug awareness will also increase the possibility of the chronic disease worsening. The commonly seen chronic disease in Hong Kong includes the high blood pressure, diabetes and lipid disorder. And we just take diabetes as an example. If your diabetes goes under control, you might lose your eyesight, you get foot ulcers, or even stroke. And this situation can only get worse if we have an aging population. A study back to 2007 shows 37% of the chronic disease patients over age 65 are having the medication non-compliance. And the present population in Hong Kong shows 13.5% are aged over 65, and by the year 2039, this number will be more than doubled to 28%. And the senior will definitely increase the pressure on our public healthcare system. And if we cannot fix it, there will be more pains for patients, and also more health expenditures will be wasted. And here comes what can we do now? At present, the public institution and pharmacy chains left a big portion of needy people underserved. So by outsourcing their drug consultation service to healthcare, etc., they can greatly increase their social impact, and also a team of professional pharmacists from healthcare, etc., could work together with them and serve the increase in demand from the market.
Okay. Actually, many people ask this question. What is the role of the pharmacist? Have your parents or your grandparents ever experienced that? When they visit the doctor, they have a lot of drug-related questions to ask. but there isn't enough time to address those problems. And when they get home, they just forget how to take those medications. And what's even worse is a lot of the elderly, they cannot even read the instructions properly. And is there a moment that you are really worried that your relatives or your family members may have taken their medications inappropriately and may suffer from the consequences? You really want to help them, but you do not know who to ask. So, a study has been showing that the average time spent by doctors per outpatients per visit is around 3 to 5 minutes. But we provide our drug consultations with 20 minutes, and we also provide follow-up services if necessary to ensure the continuity of care. So to sum up, pharmacists are the drug expert. They provide more understanding of the medications that are prescribed by doctors. And Tim will talk about the services.
Okay, so we believe that the best way to address the social problem mentioned by Helen a minute ago is to provide convenience and professional drug consultation service to people in need. Our service, Meet My Pharmacist, allow our pharmacists to conduct drug consultation service through video conferencing, which means that the people who have drug-related problems can have real-time interaction with our pharmacists at any distance. We are planning to offer this service to our target customers through forming partnership with organizations such as community centers, pharmacy chains, and insurance companies. Here is a picture to show that how we can provide our service, Meet My Pharmacist, to help a social worker from a community center so that she can better address the medication problems of the elderly. So instead of referring the elderly to see the doctor, the social workers simply just need to take out her laptop, and our pharmacist is always one click away. So this is the screen so this is what the social worker will see on the computer screen. So this is the social workers. The picture above is the elderly who is actually sitting next to the social workers. On the other side of the platform, we have our pharmacists to conduct drug consultation service in the office. Finally, if the relative of the elderly want to be part of the conversation, our platform can support those kind of requests as well. So pharmacy chains like Manning's are providing similar service to their customers. However, it's not very economically viable because it's very expensive to hire a full-time pharmacist to maintain this kind of service. If this service is carried out by their in-house pharmacists in the drugstore, that would create privacy issue. So what are the benefits of using our service? Well, first of all, we always provide unbiased and professional answers. Our partnership with School of Pharmacy from CUHK allow us to have access to their database so that our pharmacists can look up drug information in a timely manner. We help community center and pharmacy chains to save costs from hiring their own pharmacists, which may cost $500,000 a year. We also save the medical history of the patient in our database so that they do not need to repeat the same information every time they use our service. Last but not least, we provide follow-up service to the user so that we can ensure their medication problem has been addressed. So here are some of the organizations that have expressed interest in using our service. Currently, there are 7 community centers which are run by different NGOs in Hong Kong, such as Hong Kong Jockey Club and Poland Club, etc., which have dedicated funding to provide healthcare service to elderly and chronic disease patients. For profit-making companies like Manning's and the insurance company Bupa, they have also expressed interest in subscribing our service. So instead of meeting our pharmacists online, where else can you meet us? We also have an online platform called Ask My Pharmacist, which allows any internet users to ask drug-related questions in form of email. It is free of charge and is available in Chinese and English, so it is not limited to people living in Hong Kong. The other service is Health Talk, where we will invite medical professionals to talk about commonly seen diseases in Hong Kong. So for each event, we would actively look for sponsorship from pharmaceutical and FMCG companies.
Regarding the social impact, first of all, we are able to increase the public drug awareness. Through the first 3 years of our operation, we are going to reach more than 23,000 cases in Hong Kong regarding their drug awareness issue. Moreover, we can help improve the non-compliance issue in Hong Kong. In 2007, a study showed that the patients with periodic telephone drug consultation for 2 years actually has 6% lower mortality rate as well as 11% lower rate of non-compliance as the control group. As a result, with our services, we hope that we will achieve the similar outcome. Last but not least, we can delay the worsening of chronic diseases in Hong Kong. Imagine that your parents are suffering from the diabetes and they are non-compliant to the medication due to different reasons. With that situation, they may actually suffer from the uncontrolled diabetes and ultimately have some complications such as cataract, foot ulcers, and even stroke. For each stroke person, actually it costs about more than 65,000 Hong Kong dollars per patient for each time they have the one-off treatment at the hospital. As a result, with our services, we can help them to better manage their disease and their lifestyles and ultimately reduce the risk of having those consequences I mentioned and have a better quality of life.
Thank you, Jacqueline. So by now, we hope that you have a better understanding of the important role our service plays in creating a better society. If that works. Okay. So next part of the presentation, I'll show you our projected finances, future plans for expansions, as well as introduce to you our dedicated management team. We plan to charge our corporate partners a fixed subscription fee for a predetermined amount of consultations per month. Anything beyond that will incur additional costs to their accounts. As for community centers, we charge them at a low rate and also do not require them to prepay for their services. As for sponsorship, our experience has shown that FMCG companies, medical device companies, and also pharmaceutical companies are contributing on average $25,000 per health talk event. Taking into account those items, this is our 3-year projections. On year 1, we're expected to make a loss, but as we ramp up our services, we expect to have positive annual income by year 2, mainly because of increase in customer demand for Meet My Pharmacist services and also the increase in health talks. And by year 3, we're expected to break even. To give you more insights into our services and into our finance, we're going to look at the distributions of revenues and expenses by year 3. By 2014, 63% of all our revenue will come from Meet My Pharmacist, and the rest will come from health talks. As for expenses, the hiring of pharmacists will take up 62%, both full-time and part-time, of our expenses. 30% are then spent on items such as administration, sales, and marketing, and the rest, approximately 8%, are spent on items such as utilities, rent, insurance, and website maintenances. In the future, we plan to expand our business and increase our social impact by looking into 3 areas. We plan to look for new partners, expand our service offerings, and move into new regions. Bupa is an insurance company with presence in 200 countries worldwide. We're actually meeting with them this coming Monday because they have also expressed an interest in working with us. We also see a lot of potentials with other NGOs and also corporate partners, such as Safety Belt, because they have such a good and extensive distribution network. We see opportunities to work with them where we can utilize the devices and offer our services through their devices. In the future, we also look to provide medication review services and Meet My Doctor services. Medication review is a high profit margin service that is currently very popular in North America, and we see some demand in the mainland market where patients there are looking for a fast, convenient, and affordable way to get second opinions from doctors in Hong Kong. And also to magnify our social impact, our business model is actually very scalable, so we can move into markets such as Macau and China. Finally, I would like to present to you our management team. We are all full-time students from the Chinese University of Hong Kong and have a lot of experience in different industries, including the medical industry, and we have a very diverse background. Thank you for your time. We hope you enjoy our presentation.
Now, here's the time for the Q&A session. Can I ask a question? Regarding when I start talking about negative revenue, I don't understand what the concept of negative revenue. That means for every transaction you give money to a customer.
I'm sorry about that. That would be a deficit, not revenue. It would be expense.
So zero revenue, and then have a negative cost or have a loss. Is that right?
Are you referring to the slide where? I'm sorry. The bar chart. This one, right? Yeah. All right. Annual income and net profit. Yeah, we have negative annual income and net profit in year one, and net profit. Sorry. Donation. Basically, incurring expenses without generating enough revenue to cover it, as you can see on this slide. So in year one, our revenue is not as much as our expenses, as you can see from the blue and red bars. But as we move on and ramp up our services, by year 2 and 3, our revenue will be larger than our expenses, and by that time, we will be able to generate positive annual income, and we'll be able to generate annual income, I guess, and have net profit by year 3.
How much are you going to pay your pharmacists?
For full-time pharmacists, we plan to pay them 42,000 Hong Kong dollars per month plus an annual increase of 5% in wages.
So, because I saw your proposal, you say you're charging $200, and then I look at your subscription model, it's a bit less than that, so it's $100-something per session. Each session, 45 minutes?
20 minutes per session.
So it's 20 minutes. Here is it. Okay, so 20 minutes per session, $100-something, and have you tested the market? Is that what people are willing to pay?
Well, there are two.
And then for the community center, we're talking about $80 per consultation. If your target is the underprivileged community, who are only paying, $60 for medical consultation in a government hospital, you think they're willing to pay $80 for a pure pharmacist consultation?
Okay, first of all, the number 100 is not exactly the patient pay us. By outsourcing the service for us, the corporate is actually a partner with us. So we're charging the corporate to pay us. And the number you see is the average. We estimate the average cost for each one visit for them. And we charge them as a package, but we're not limited the numbers they get the consultant from us. But there's a service limited. For example, like if in the initial stage, the required from the customer is only 300 calls per month, and this fee will be fixed. But if the number exists to another range, we will charge another package price. So that price is only the estimation of every call, but the end user is not actually paying us.
I'm talking about the lower one. Okay. On the upper one, you're talking about corporate partners. I honestly don't know. Okay, Bupa, I don't know Bupa's business model. Maybe they're willing to pay, I don't know. But the community center, you're talking about $80. These are individuals, right? These are
community centers paying.
You're talking about Jockey Club and these people paying $80. And you check with them, they're willing to pay for this kind of service?
Yeah, actually, how we come up with the $80, currently, if their social worker goes to outreach to visit the elderly, say if they want to bring the elderly to the public hospital to have a consultation from a pharmacist in the public hospital, they will actually charge $80. So actually they have...
You're talking about those 陪診服務。
嗰啲其實係如果因為佢哋有啲社區中心，佢係有啲社工係定期去探譬如嗰啲獨居長者啊咁樣。咁但係如果當佢發現佢哋係可能有啲藥物上嘅問題嘅時候，可能佢哋要尋求一啲專業嘅意見嘅時候，佢哋就會 refer 嗰個老人家去翻嗰個public hospital 去睇嗰個藥劑師或者醫生。咁嗰個 charge 其實係10蚊。咁所以我哋係 base on 嗰個 cost 嚟到收翻個價。咁而我哋亦都接觸過一啲 community center， 其實佢哋係有呢個 budget 係去 provide 呢啲 medical patient 呢啲 healthcare 嘅 service 係俾啲老人家。
partners, are you talking about many of the partners? You charge, how do you charge them? You charge them, for example, 37,000 per shot, and you get over 300. How do you get the income for yourself?
Customers from Mannings that have already subscribed to the FaceTime services. Are you aware of the FaceTime services from Mannings right now? You are? No. Okay. Mannings offer FaceTime service for some of their customers, some of their members, where they can access to they can have access to a pharmacist via their iPhone application. The problem with their current service is that they do not have a dedicated personal pharmacist to answer those calls. So calls that are so when I try to call Manning and try to see my pharmacist, the phone call will basically whichever store that has a free pharmacist on hand that can answer the call will then answer the call. The problem is a lot of pharmacists at Mannings has 300 stores in Hong Kong. They only have 50 stores that offers pharmaceutical services, and even less pharmacists because pharmacists move between stores. And so the problem is they're at the public area, they're always doing things that are not necessarily related to pharmacy. They might be doing inventory counts, they might be walking around and helping other customers. So the service provided by them is severely degraded in a sense. So for us, when Manning outsourced their service to us, so we're expecting for 300 consultations per month from all their stores combined, which is their current numbers right now, we will charge them this fee for outsourcing their service, for providing the service to their customers.
So is it more expensive or cheaper than what the consumer is paying Mannings now?
The consumers right now are not paying Manning anything.
It's not paying Mannings anything.
Well, okay. It depends on how you look at it, because while they offer this pharmaceutical service, they also sell a lot of drugs. Yes.
And they're willing to do this?
We're working with them on this.
This seems to be the concentration of customers. We high risk in this area. I'm not sure how high the bargaining power is managed.
Okay. The first thing is that it's very difficult for a single corporate to operate this department separately, because first they will increase a lot of their operation cost. They are not only simply paying a pharmacist, but they have to run this whole business at the segment. So the operation cost is actually high. It's hard for them to sustain. And also, they are lacking of the professional pharmacist resource, because we have the backup resource from the School of Pharmacists from the Chinese University of Hong Kong. So we can reach the professional database and also the updating pharmaceutical knowledge. And with this kind of profession, and we can also help them to build up their brand name. They can have a better, reliable image to their customer. They partner with the professions, and they can better persuade the customer to rely on their consultation. So that we are not only offer this consultation, but also help to build the image of as a professional drug provider in the market. So I think it's a long-term and also sustainable short-term business now.
On the issue of privacy, you said here that this scheme, Meet My Pharmacist, has a privacy issue. The Mannings one, right? So are you saying that your scheme does not have a privacy issue?
Actually, we offered a one-to-one service. You can, if, for example, take an example, if some girl wants to ask a very embarrassing question like oral contraceptive, he can reach us by different methods, by email or by make appointment with our pharmacist, or even by visit us in our health talk or healthcare event. So we can take care of these embarrassing questions really in private, and also offer them the tailor-made prescriptions.
I want to add Alan's point. So why they are having privacy issue right now? Because like Alex mentioned before, they don't have the dedicated resources just to maintain this service. So what they are doing right now, they're conducting the drug consultation service in the pharmacy, the drug shop. So So imagine if you, when they are doing the consultation through the iPhone, anyone in the store can hear what they're talking about. And those are very sensitive or private information. So that would create this privacy.
I believe there are similar models, in the United States, right? Have you been looking into, their success stories and, in helping you craft out your own business plan?
We have did some research online only on the type of pharmaceutical services that are offered in North America, because the current medical system in Hong Kong does not place a lot of emphasis on using pharmacists. And what we are seeing from those systems is that they usually have an online platform where you have the option to talk to a pharmacist and you have to pay for that service yourself. And at the same time, you can order drugs, pharmaceutical drugs, directly from those websites, and where they will then ship it to you afterwards. We believe the current regulations in Hong Kong does not allow us to do that. And yes, so in short, we did look at their models.
And I would like to add something is currently the local people's drug awareness is relatively low comparing to the developed countries. So that's why we put our medication review this business to sometime later, because we have to raise their awareness of how important the pharmacy is and how important for them to take properly the drug first, and then it is our opportunity to start this business segment at the right time. So actually we have a lot of chance and a lot of different business to start in the future, but now we are start with a very safe way to sustain the business first.
Can you walk me through, a regular session? What kind of questions can you answer, and what kind of questions can you not answer? Because you certainly do not have the personal medical history of that old lady. And so, if the social worker shows you, these are the drugs you should take, so what kind of things can you offer them that, that would not have been written already on the package of the medication?
Okay, so the type of questions that the pharmacist can answer could include the type of side effects, and a lot of the side effects are not actually written on the package. And also, the pharmacist can answer the type of drug interactions in between two medications. Especially the pharmacist can, some people may be taking Chinese medicine, and the pharmacist can also answer those questions for the type of Western and Chinese medications interaction. And the pharmacist can also elaborate on the management of the disease state, like the importance of managing different outcomes. For example, for measuring the hyperglucose, the importance of that, and mentioning the lifestyle as well.
I would like to quote an example I saw when we received from one of the patients. So she is a cancer patient who wants to take Chinese medicine and Western medicine at the same time. So she wants to know whether if there's like any interaction between the medication and whether she can do that. And the other example is that there's also a cancer patient. She is suffering weight loss because of taking cancer drug. So she wants to ask if she should stop exercising to prevent further weight loss. So those type of questions can be answered by a licensed pharmacist.
And the pharmacist can also answer any over-the-counter medications, for example, cough and cold medicines, and also supplements. For example, what's the best time to take calcium, and what are the common side effects for taking calcium, and what's the recommended dosage for taking those supplements.
How is this video conference pharmacist? How prevent that sort of symptoms So if I forget to take my medicine, then how will I remember to not contribute to
Okay, this one, let me give an example. Because we work together with the community centers, and they are visiting the elderly with chronic disease regularly. And some of these elderly are hidden elderly. But these community center workers, they don't have enough knowledge to know whether they are taking properly their drugs or not. So they just bring our laptop to their place, and then they show us their drugs, and we tell them what is the right way to take these drugs. And they can follow up with these hidden athletes or these people from poor areas to do this right medication usage like this. Yeah, so we are partners with the social workers and also some other partners, and to follow up, to do the follow-up plan.
The way I say it's not really a reminder of taking medicine, then really nothing to do with taking the drugs online. That's my observation.
You mean our service is not really reminding them that they should be taking their drugs on time, right? So that's why we see a professional partnership with Safety Bell, where their service, which basically their distribution network or their placement of their devices is crucial, because currently they are offering similar service as Safety Bell, where they might call to say, hey, it's time for you to take your medicine, right? The problem is, if I'm at home and I'm, let's say, 70, and I have this bottle here of pills, they look like M&Ms to me. Because there's the tendency for elderly to put all their medication in one box and then mix them together. That's the problem, where if I know, okay, now you tell me I have to take my pills, okay, I'll go there and pick a pill and eat it. But is that really drug compliance? And that's really where all the problems and the risk of worsening of the chronic disease come from. And that's where the wasting of the drug is costing us 1.1 billion annually, and also the consequences of it. The consequences of blindness, foot ulcers, and also strokes are actually adding more cost to our healthcare system than before. And not to mention the subsequent influence and effects on the patient's health and also people around them.
There are 5 of you here. Who will be running this enterprise full-time, and what are your roles and division of work?
First of all, let's go with Teresa. She is actually a registered pharmacist at British Columbia, Canada. She has taken 2 of the 3 exams that she's required to take before she can become a full-time pharmacist in Hong Kong. So by taking and hopefully passing the exam in June, she will become our full-time pharmacist. Also, included in our business summary or business plan are 2 full-time positions. One is the financial controller, and the other is the basically project coordinator and general manager. Tin here is our general manager, and I'll be taking up the position of finance director. And here, because we are all full-time students, and some of us are actually going to go on exchange in the future, they'll be working full-time as much as they allow them to. Because if we're studying full-time already, they might be spending their weekends helping us in terms of developing our businesses and so on.
Any other question?
Well, just to follow up on that, so I appreciate the elaboration, but I don't understand. So who is working full-time? So who is working, who is not?
Because actually you can see I have a marketing and sales experience from the medical device industry. So I will leverage my knowledge into the marketing and sales. And this kind of job, I think it will be very flexible for me to work. So it's totally okay.
Included in the financial summaries are
your salary, huh? Yeah.
A full-time pharmacist is $42,000 with 5% annual increase. We're looking at $12,000 roughly salary. Again, 5% increase annually. It might be 14,000. We forgot which one was.